Okay, we did it. We're live. Happy Tuesday, everyone. Trendy Tuesday, as per usual. I hope you got a chance to catch our Spanish live, but if you didn't, welcome back. This is our English live for those of you who do not speak Spanish. Totally fine. Tonight, we are discussing birth control and antidepressants, as well as some other medications and essentially how they can affect your birth control, if they affect your birth control at all, and all of that fun stuff. So before we go into that, just a couple reminders. As always, if you have any questions, feel free to leave us a comment down below, and we'll either get back to you during the live or after the fact. We are also the only women-led, doctor-led birth control delivery service. So don't forget that, super important. It's actually Women's History Month, so that's really exciting. So don't forget that, claim your titles, as Dr. Yen always says. And yeah, I'm excited to talk about all of this. So without further ado, let's just get into some questions. So these are some trending questions about birth control and antidepressants. The first question being, and this, I'm gonna make it kind of like a twofer. Number one, what is an antidepressant, anti-anxiety, and why would that be prescribed to someone? And then number two, if someone is on birth control, is it okay for them to take that? Go for it.
Yes. What is an antidepressant? So the most common antidepressants are the selective serotonin reuptake inhibitor, so SSRIs. And how that works is serotonin is, I think, of the happy hormone, and the selective serotonin reuptake inhibitor blocks the body from sucking up the serotonin and then breaking it down. So that way it keeps more out in the blood, so it lasts longer and keeps you happier. And when somebody has depression, I think of it, they were born with a lower level of happiness or serotonin, and they're at like a level of 3. But if they hit 0, then they want to hurt themselves, kill themselves, or die. Whereas everybody else might have been born at a level of 5. And so when they get sad, they go to 3. But when the 3 person gets sad, they go to 1 or 0 a lot faster. And so by bumping up their serotonin level, it doesn't make them crazy. It just makes them equal to everybody else. And I think of it as a kind of safety net that's there. Who would be using an antidepressant? Anybody who's depressed. So if you want, there's lots of quizzes online. You can do a PHQ-9, which is 9 questions that ask you about, are you sad? How are your interests? How's your concentration? How's your energy? Do you feel guilty? And then I forget what the last E stands for, but there's a whole bunch of different side effects or symptoms of depression. If you have enough of them, then you're diagnosed with depression, and then you need to see a psychiatrist in order to write those medications. A psychologist, both of them are called doctor, but one's an MD and one's a PhD. The PhD can't write drugs because it's a PhD, but absolutely has studied a ton and is amazing for diagnosis and also for talk therapy. The MD can do talk therapy, but the MD, more importantly, can write the drug. So that's what the most common antidepressants are. Sometimes we'll see people for anxiety take kind of anti-seizure drugs, and that's kind of just to calm them down. And those are the drugs that have interactions with birth control. So the good news is the anti-seizure drugs that we've seen lately for anxiety or depression, lamotrigine, does not affect the birth control, but more the birth control revs up the liver, which eats up the lamotrigine faster. And so that person may have less of an effect from their anti-anxious drug and may need a higher dose. So maybe normally is 150, but might need 200 or 300 because of this revving up of the liver. So the good news is you don't risk pregnancy with that particular combination. But there are so many different drugs that a psychiatrist could write that are not in my standard box, but anytime it's just important, tell the physician that's writing the birth control every single drug that you are on so that they can put the 2 in and look for all the different combinations to see if there's any interactions and warn you. And conversely, tell the person that's writing your psychiatric meds what birth control you're on, and they too can look at those interactions and at least counsel you, oh goodness, the one I'm putting you on will decrease your birth control efficacy and you should use condoms or backup or something like that.
No, I think that's really good to mention, because I feel like a lot of people, when they are so desperate to just kind of get on medication, they might not consider all those outside factors, but that's a big thing. And it's really important to know, like, okay, maybe my birth control won't be as effective, still work, but maybe we have to change some other lifestyle factors around using condoms, things like that. So I am glad you mentioned that. I feel like, again, very underrated when working with your doctor, and always like talk to a doctor, of course, if you're thinking about going on things. Definitely don't go right to the internet. I would say that depression test, though, I would say is great, but anything past that, I feel like, which medication should I go on?
No.
Maybe start with
Leave
the
that
doctor.
to the doctor who went to med school, who studied the drugs, who knows the side effects, who's treated thousands of patients,
Yeah.
as opposed to you who have treated yourself on the internet. I do want the take-home message not to be that the antidepressants or the birth control will interactivate each other. It is the rare, specific anti-convulsion medicine that's used for anxiety that has that interaction. Most antidepressants, which are the SSRIs, have no interaction with the birth control pill, patch, ring, IUD, implant, or shot.
Sure. So that would be like, I feel like the big names of that are like Zoloft, Prozac, Lexapro, all of those. Like the big names usually you're good.
Yeah. I might have to look up Lexapro, but the
Lexapro, yeah.
Prozac, Zoloft, fluoxetine, sertraline are the generic names of those two.
Yeah. Okay, cool. No, that's really good to know. So kind of going off of that, how about medicine for ADHD, such as Adderall? I know that's a big one. There's another one that I can't think of. Adderall's the main one, I think.
Yeah,
So how does that work?
there's like Adderall and Focalin, anything that's like an amphetamine derivative, I think revs up your liver. I've seen it happen to me with over-the-counter Sudafed. And that's often put in anti-allergy meds, or it's put in cold medications. So
Uh-oh, I think we had a little freeze. Let's see. If anyone is watching, can you just leave me a comment and tell me if Dr. Yen is frozen? Technical difficulties, but that's okay. She might need to come out and come back in. But in the meantime, what she was saying was basically that if you do take certain medications, I would recommend definitely consulting with your doctor to see what impact that could have on your birth control and vice versa. Oh, Dr. Yen is frozen. Okay, she'll be back. She'll be back. So let me just talk in the meantime. Okay, so yeah, I would say that definitely consult your doctor. We also have a lot of blog posts on Pandia about the relationship between mental health and birth control. I would say both are two things that kind of go hand in hand, but also are slightly unrelated. So definitely consult with your physician or mental health professional or both when you're considering either starting birth control or starting an antidepressant, or again, vice versa. Yeah. So we were also going to talk about how to improve mental health with using birth control, but I want to speak with Dr. Yen on that when she comes back. So just some other things to mention about Pandia Health. We talk a lot about periods optional, which is our big campaign essentially to remember that you don't need to get a period. Also, Dr. Yen is coming back. I'm telling her that I'm stalling. So you don't need to get a period with at all, basically. And so when you're on birth control, it's a really safe way to kind of skip your periods. If you're not on birth control and you find that you're not getting a period, that could be a sign of potentially a negative health consequence, such as intense weight loss or some other health complications. So again, that's a little bit different. But if you are on birth control, then it's totally fine to skip your period. Essentially, you just skip the last row of your pack. So say you have like a 28-day pack, usually the last week is going to be sugar pills, and you'll know because they'll look different than the other pills. You can just not take those and go right into your next pack, and then you don't get a period. There are a lot of benefits to that. First of all, not having fluctuating hormones. So all of the negative effects that you get when you get your period, cramps, bloating, headaches, temperature fluctuations, all of that kind of stuff, you won't have because you just keep stabilizing your hormones. Otherwise, you're kind of going up and down. And it's totally fine to not get a period. I know there's a lot of controversy about that. People will think that their uterine lining will just like build and build and build. That's actually not the case. It's just going to be a much thinner lining overall when you are on the birth control. So yeah, it's totally fine to skip your period using birth control. But again, if you're not on birth control and you're missing your period, that's something that you would want to consult a physician about. So yeah, that's the first thing. Also, don't forget to check us out on social media. We have Facebook, Twitter. We are recently on LinkedIn. We have a YouTube channel where we post all of these lives, and there's also some other fun videos, some DIYs, some other tutorials. So definitely check us out on that. We're always at Pandia Health. Definitely look on our social media for any like fun collabs we're doing and all of that. We are also open to answering any questions. So you can always message us and we can have one of our patient care advisors get back. So there's that. I'm trying to think of what else to say. As always, if anyone has any questions, feel free to leave them down below. I can just talk a little bit more about how I feel with birth control and like what it's done for my mental health. I would say that it has definitely helped. If nothing else, it hasn't hurt. So when I started birth control, the biggest thing was that I didn't have to worry about not knowing when my period was going to come. I had super irregular cycles before. When I started taking birth control, it was very regular every month. I knew prior to me knowing that it was safe to skip your period, I always knew that that last week was when I would be able to, when I would get the period. So if you're super irregular, the birth control can be really helpful with that. It also, again, can minimize symptoms of premenstrual syndrome, so PMS, which again, cramps, bloating, all of that unpleasant stuff. I've also found that it really helped my skin. I know this is kind of different depending on whether you take the pill, patch, ring, shot, etc. And if you're on the mini pill versus the combination pill. But for me personally, I found that it, again, maybe it wasn't the birth control that helped, but if nothing else, the birth control didn't make my skin worse. So again, lots of benefits. I could honestly go on all day. There are a lot of myths out there about birth control, about how it can impact your fertility and it can make you feel really sick. I would say that if you are encountering any of those things, just definitely consult with your doctor. It's really easy to stop taking birth control. There's also like over 40 different types. So if you don't like the first one that you're on, you can just start something else. It's that simple. Again, talk to a doctor before you just go on something else because they're going to have the expert advice. So always do that. But at the same time, don't be afraid to not like your birth control. That is totally normal and common. So just some things to keep in mind. Dr. Yen is still having some technical difficulties. I'm just gonna hear for the next couple of minutes. If anyone has any questions, feel free to leave them down below. Trying to think of some other topics to talk about. It is Women's History Month, so definitely celebrate yourself if you're a woman, but also celebrate your female friends, colleagues, family members, all of that. And use this time to study up on how you can be an ally to women. I know last month was Black History Month. That doesn't mean the work is done. So, oh, Dr. Yen is back. But anyway, keep educating yourself on how to be an ally and all of that. I was totally just stalling for like 5 minutes, but it's fine. I talked about periods optional, which I would have talked about at the end. So we got that covered. But anyway, just to continue where we left off, so we were talking a little bit about the effects of ADHD patients such as Adderall and birth control, if you just wanted to like give a little recap of that.
Yes. So for ADHD meds, they're amphetamines and they kind of rev up your system and sometimes can rev up either your liver or your metabolism and chew through other medications more quickly. So the birth control will not affect the ADHD, but the ADHD might eat up your birth control medicine. So if you notice that you weren't spotting and now you're spotting, that's always a sign of maybe something's eating up your medicine more than usual, and you might need a higher dose of the birth control to cover you for pregnancy, or you might need to use condoms as well. Another one that you triggered me to remember was over-the-counter pseudoephedrine. So if you have pseudoephedrine in a cold medicine or an allergy medicine, then this too can affect your birth control. So this, unfortunately, is over the counter, and you're just going to have to know when you get breakthrough bleeding or you end up pregnant that it didn't work. But I'm just sharing with you that pseudoephedrine for me has been known to mess up my birth control. So
Yeah, I've actually noticed that too. I know it also sometimes just makes you feel kind of gross. Maybe that's just me, but some of those over-the-counter medications. So again, really good to know. Also, I wanted to ask, because this is my thing when I was blabbering on my stalling. So I was talking about periods optional, and I was saying that when you're on birth control, it's totally safe to skip your period. But I was also trying to remind everyone that if you are not on birth control and you're missing periods randomly, that's not what you want. You can control it yourself. That's good. Bad if it's not necessarily a bad thing. It could just mean you have a lifestyle change, or you're more stressed, or you've lost weight. But that's something you might want to consult a doctor about. I just wanted to,
yeah,
clear that
anytime
up.
you're missing 3 periods in a row and you're not on any medications, go see a doctor. See if it could be stress, it could be weight loss, it could be weight gain, it could be pregnancy. It could be a tumor in your head, it could be thyroid. It depends how old you are and what other symptoms you have. But without medications, people in the United States generally with a uterus of reproductive age should be having a bleed or period every single month. However, with medications, we can choose if we want to bleed every month, every 3 months, every 6 months, or never. And again, I love to say I haven't bled in 11 years as long as I take my medication and as long as I avoid the Sudafed.
Yeah, it's really good to know. And yeah, also that there's such a that your lining is just going to like build and build and build, and then to like have to come out sometime. But I was saying how I've learned from me that with control, it just stays a lot thinner, so you're not getting that same buildup every month, which I think is really cool. Our bodies do really amazing things.
It's amazing our ability to grow another human being, but it's also taxing how much energy we with uteri put into our uterus filling with blood so it can then grow something for 9 months, versus if you're on the birth control pill, I think of your uterus filling up to level 10 when you're trying to catch an embryo and grow it for 9 months, versus if you're on the birth control pill, patch, ring, IUD, implant, or shot, it's like level 1 or really small. And so you can choose to change that out every 9 months, every 3 months, every 6 months, never, whatever. In general, probably once or twice a year. That's what I meant, not per month, but yes, once or twice a year.
I got you. I knew what you meant. Last question, going back to kind of the mental health topic. Can birth control positively impact your mental health? We're talking about kind of all the negative stuff, but let's talk about the positive stuff.
Yes. So there was a research study done in a bunch of Danish people, I believe. It was a giant number. And what they found was that people who were prescribed birth control were more likely to be prescribed antidepressants. But they didn't control for a lot of factors, such as people who were prescribed birth control are seeing doctors more frequently. So in our clinic, we're required to check for depression at least once a year. And if we catch it, then we're going to suggest pills. And somebody who would take a pill for birth control might also take a pill for depression. Whereas a person that was like, yeah, like natural methods and just condoms and spermicide might never go to the doctor and never get prescribed. And so their measure was prescription as opposed to screening general people for depression. And then when people put together 7 or 8 studies that were out there, they actually showed there's no difference in the general population of depression versus percentage of people that are depressed over here versus people who are on birth control in terms of percentage of depression over here. And in fact, they saw that many women's mental state was improved by the birth control pill. And I think personally, one is just that anxiety of, holy crap, every time I have sex, the condom could pop, I could end up pregnant, or I just could end up pregnant. But if you're on the IUD or the implant, you got like no worries, the shot as well. Yeah. But the ring patch pill, you got to remember to go get it. And there's like some stressors, but being on it is greater peace of mind than if you're just using a condom, or if you're just using condoms and spermicide, or if you're just using withdrawal, or you're using the fertility awareness method. And then mental health wise, I'm always an advocate like you explaining #periods optional when you keep your hormones smooth. And so those people that are not on the birth control pill, patch, ring, who are not on any medication, hormonal treatment for birth control, your hormones are going up and down, because every month it's growing and it's like, embryo, no embryo, bleed, and then grow again, embryo, no embryo, bleed. And so it's going up and down, up and down, up and down. But those of us who are on the pill packed ring are just smooth. And so for depression, asthma, seizures, diabetes, arthritis, all of these things are better with smooth hormones rather than up and down and up and down and up and down.
Exactly. Yeah. That was another thing I was saying when you were off camera. I was just thinking, like recalling my experience with birth control and saying that it wasn't necessarily the birth control that like cured all of my problems with depression and anxiety, but it was just one less thing that I had to worry about with the period every month, and then just like the changes in hormones and the headaches and all of that. So after a while I was thinking like, oh yeah, it did help. It was great. So again, don't expect it to be the end all be all to all of your mental health problems, but it can definitely positively impact you. And I was also mentioning that if you have something that isn't helping, or is potentially making your symptoms worse, there's so many other options for you to try. Might not be your perfect match.
It's important for people to know if you tried one pill, there are 39 other pills that could work for you, birth control specifically, and that it's very important to know which progesterone you're on and ideally what dose. So often it's like 120, 135, or 150 micrograms or something like that. But there's 8 different progesterones. And so if one progesterone didn't work for you, there's still at least 7 others. And then there's often 2 or 3 different doses of that progesterone that you can play with. So don't give up. And it took me like 3 different pills to finally find the pill that worked for me. However, at Pandia Health, we're taking our knowledge, having written 2,000 birth control prescriptions in 2 years, and looked at the differences in ethnic response and be like, oh, most people do better on this one. So let's start people on this one so you don't have to go through the 3 pills that I went. You can just jump to the answer.
Yeah. Yeah. No, and that's really nice. It's nice to know that you're in expert control and not, again, have to do that Google search, like which one's the best for me? And you always end up on either there's like Drugs RX or WebMD with the reviews. And then there's all these horror stories. But of course, the people who had the horror stories are going to write their reviews. So
you will only find bad reviews. Very rarely do you find the happy person, because the happy person's happy and the unhappy person's really unhappy and also wants to share with the world and prevent other people from being unhappy. But just because it happened to that one person doesn't mean it's going to happen to you. And know that the reviews are absolutely skewed. But the other kind of decreased stress is why we created Pandia Health. Set it and forget it. Let us worry so you don't have to. Because that's another like thing that we with Uteri just suck it up, is this nagging, what I call pill anxiety. Every single month as you get to that last week of pills, if you don't get to the pharmacy by this day, there will be a bad consequence. And we have that for 20 to 30 years of our lives, and hashtag better things to do. So that is the whole reason we started Pandia Health, was let us worry so you don't have to hashtag Pandia peace of mind.
Yes. Also check out, it'll be posted on Thursday, I believe, but I saw that you were just featured in a podcast with Women Founders Network, I believe. And I saw that you were talking about the history of Pandia Health and all that. So check that out. That'll be posted later this week on Spotify and iTunes. Very exciting if you want to learn a little bit more about our women-led, doctor-led. And other than that, that is pretty much it. Do you have any other last things you want to add?
Yeah, just, in general, we can deliver to all 50 states. So if you have a prescription and insurance to cover it, you pay us nothing. And we send you as much birth control as your insurance and your doctor will allow. So encourage your doctor to write 1 year's supply, be it 13 packs if you're not skipping, or 17 packs if you're skipping that last week. And we'll send whatever your insurance will allow. And we throw in a free goodie. So sometimes a high chew. I'm really excited. We just got almond roca and dark roca. So as it stays cool and hopefully it won't melt, then we can send out some of that. And we had a collaboration with an amazing soap company that is like the most fanciest, rich, lathery soap. I just love the smell, but some people didn't like the name of the company, but I didn't control it. It was just an amazing soap that was willing to give us free samples. Who's going to say no to free when it's good stuff? If it's bad stuff, we're not sending it to you. We're only sending you the good stuff.
There's also I got a mascara once I got like a little sampler. Yeah, there's a lot of fun stuff. So check us out. Share with your friends if you're a guy and you can't use birth control. Share with your female friends because someone out there can definitely benefit. So yeah, that is it for us tonight. Apologies for the technical difficulties. Thank you so much for
Yes.
bearing with us and my rambling. Hopefully you got something out of that. And if not, we'll be back better than ever, probably next week. Same time, same place. So don't forget, you can also check us out on all of our social media, as I mentioned before. Otherwise, have a great evening. Stay safe and yeah, keep living your best life. Keep looking up Pandia Health. Have a good night.
Have a great night.